Sickle cell disease, also called SCD, is a genetic disease that affects the blood. Many people have heard of the term sickle cell anemia, which is the most common form of sickle cell disease and the focus of this video. Worldwide, millions of people suffer from SCD. About 80% of all patients live in Sub-Saharan Africa. Outside of Africa, SCD is most common in Southeast Asia, mainly India, and in the Eastern Mediterranean region. In Europe and in the United States, SCD is much less common and can often be found in people with African ancestors. Sickle cell disease is an autosomal recessive disorder, which means both parents must carry the mutated gene and pass it on to their child in order for the disease to develop. Furthermore, SCD is a monogenic disease, which means only one gene is mutated and responsible for the symptoms observed. Sickle cell disease is a multisystem disease, which entails episodes of acute illness as well as progressive organ damage. Severity and kind of symptoms differ among patients depending on the exact kinds of mutations, also referred to as genotype, and other environmental factors. Some of the most common symptoms include chronic anemia and acute anemic episodes, painful episodes from vaso-occlusion, acute chest syndrome, and stroke. There are many more symptoms that affect different organs like the kidneys, spleen, and heart, but for now, let's focus on the most common and severe symptoms. Chronic anemia and acute anemic episodes. Chronic anemia occurs when, on a chronic basis, there aren't enough healthy red blood cells to carry oxygen to a person's organs. This often is the case in sickle cell disease as the oxygen-carrying molecule, hemoglobin, is defective. An acute anemic episode differs in that it is an event where a high number of red blood cells die, leading to a lack of oxygen transport. Painful episodes from vaso-occlusion. Vaso-occlusion occurs when the circulation is obstructed and blood can't flow properly. This happens in SCD when sickled red blood cells block blood vessels. The result of these obstructions is a painful event, often in extremities, feet, and hands. The pain level differs, but sometimes when pain is unmanageable, patients require hospitalization and treatments with intravenous opioids to find relief. More than 3 painful events with hospitalization per year is associated with an increased mortality in patients over 20 years. Unexplained death during painful episodes can also occur. Acute chest syndrome. This usually follows a painful episode and is extremely dangerous. Symptoms are fever, chest pain, wheezing, cough, and hypoxia. Acute chest syndrome is a frequent cause of death in patients with sickle cell disease and sometimes culminates with multi-organ failure. In children, acute chest syndrome occurs more often, but is usually less severe. In adults, however, albeit rare, acute chest syndrome is highly dangerous. Stroke. Strokes are very common, especially in kids with sickle cell disease. This is because sickled red blood cells, in combination with a reduction in nitric oxide, damage the walls of blood vessels. When this happens in the brain, we speak of cerebral vascular damage. Together with high rates of blood flow in patients with SCD, cerebral vascular damage leads to a high risk of stroke. So what exactly happens in sickle cell disease? Let's take a look at some background before diving into the genetics. Humans need oxygen to survive. It is the fuel that all our organs run on. Red blood cells, also called erythrocytes, are the special cell type that transports oxygen throughout our body. Erythrocytes are produced in the bone marrow and have a lifespan of about 100 to 120 days. Special about erythrocytes is that they don't have a nucleus. That's because in order to move through tiny capillaries, red blood cells have to be smaller than most other cell types in our bodies, and they need as much room as possible to store hemoglobin. Hemoglobin is the molecule that binds oxygen in the lungs and releases it in the tissues. Hemoglobin consists of 4 individual units that are connected to each other. Those units are called globins. The composition of those globins determines the different kinds of hemoglobin. For example, during fetal development, red blood cells mostly carry hemoglobin F, or HbF. HbF consists of 2 alpha and 2 delta units. Until babies are about 6 weeks old, HbF is the predominant form of hemoglobin. Afterwards, HbF gets slowly substituted with other kinds of hemoglobin. The most common hemoglobin in adults is Hba, which consists of 2 alpha and 2 beta subunits. Other kinds of hemoglobin exist, but make up only a small percentage of the overall hemoglobin. Erythrocytes are packed with hemoglobin molecules, and each hemoglobin can bind up to 4 oxygen molecules. In oxygen-rich environments like the lungs, hemoglobin takes on a shape or conformation that allows the binding of oxygen molecules. When erythrocytes travel to places in the body that are in need of oxygen, the conformation of hemoglobin changes and releases the bound oxygen to the environment. Blood then travels back to the lungs, and the cycle repeats. How is this process disrupted in patients with sickle cell disease? Sickle cell disease is a result of a mutation in the gene producing the beta units of hemoglobin. This gene is called beta globin, or HBB gene, and is located on the short arm of chromosome 11. Different mutations exist, leading to different kinds of sickle cell disease. The most common kind is sickle cell anemia, in which a patient has 2 identical mutations replacing the beta globin units with a mutated version called S globin. The S globin is produced when patients carry a nucleotide substitution of A to T in the codon for the amino acid at position 6. Instead of glutamic acid, the A to T transversion leads to incorporation of the amino acid valine. This seemingly small change has dramatic effects. When hemoglobin is deoxygenated, meaning it is in the state where it doesn't carry any oxygen, it binds to other deoxygenated hemoglobins, forming polymers within the erythrocyte. These polymers change the shape of red blood cells from its usual donut-like flexible disc to a sickle-shaped rigid cell. Although the polymerization is reversible when hemoglobin binds oxygen, it causes a lot of damage. The polymers changing the cell shape cause membrane damage that, with recurring events, will ultimately lead to hemolysis, the rupture and destruction of the erythrocyte. Additionally, the rigid sickle cell doesn't flow as freely and unhindered through blood vessels, which often leads to obstruction of such. Hemolysis leads to many complications. For one, if many erythrocytes die at the same time, the patient will suffer from an acute anemic event, as talked about earlier. Additionally, with hemolysis, erythrocytes secrete a protein called arginase, which metabolizes arginine. This means less arginine is available in the environment, and other processes that require arginine are negatively affected. For example, the production of nitric oxide, NO, is dependent on arginine availability. With arginase in the bloodstream after hemolysis, less production of NO can occur, leading to a lack of NO bioavailability. This has multiple downstream effects, such as hypertension or high blood pressure, and hypertension specifically in lungs, which is called pulmonary hypertension. Pulmonary hypertension is very dangerous and can be lethal. Recurring vaso-occlusion due to sickled erythrocytes lead to progressive damage to most organs, including the brain, kidneys, lungs, bones, and cardiovascular system. What does the prognosis for people with sickle cell disease look like? Life expectancy for people with sickle cell disease is difficult to predict as disease progression varies widely. Many children die at a young age, but there are also a lot of people surviving into their 50s. Different factors influence how long a person lives and what their quality of life looks like. For example, people who have higher percentages of fetal hemoglobin in their blood have a better prognosis compared to people with low HbF. This is because HbF is thought to decrease polymerization. Furthermore, people in more developed countries usually get better care. This means they have more access to medication, although not many medications are available for SCD, and other treatment options. One common and seemingly helpful treatment strategy is regular blood transfusions. You basically want to dilute the percentage of sickled erythrocytes to avoid serious complications. In some rare cases, people can receive bone marrow transplants, which are the only cure for SCD at the moment. However, only a very small percentage of patients qualify as a compatible donor is required, and the procedure is dangerous, leading to death in about 7% of the patients who undergo bone marrow transplants. People in Africa usually have the most severe clinical courses of sickle cell disease. Partly, this is because of access to medical care, but infectious diseases also play a role. Malaria, for example, is a great danger for people with SCD. Interestingly, carriers of sickle cell disease, people who carry only one allele of the mutated beta globin gene, have an advantage over people with 2 healthy alleles when it comes to malaria infections. This may be one of the reasons why sickle cell disease is most prevalent in countries that were or are still exposed to malaria. In this video, I only covered sickle cell anemia, which is one kind of sickle cell disease. There are many other genotypes leading to other kinds of sickle cell disease not discussed here. For more information, check out the literature I linked in the video description.